All right, all right, all right. Welcome, everybody. It's Menopause Monday. I cannot believe we're at the second week of December. This is insane. It's going
No, crazy.
rapidamente, which is a little crazy. But today's going to be an exciting topic, bone density and menopause, which is so very important for us. So today we have two amazing guests, Sacha Chung and Dr. Stephen Lofters. Sacha is an occupational therapist with 25 years of experience treating sports and orthopedic conditions. And Dr. Lofters, you are a consultant radiologist. Am I correct in that?
Correct.
All right, awesome. Okay, so today's about, as I said, bone density in menopause. And we know that during menopause, a woman's bone density significantly decreases due to the drop in our estrogen levels, which then, of course, is going to increase the risk of osteoporosis, bones become brittle, we're prone to fractures, and being such an integral part of bone strength, I think it's so important that we've addressed all of the estrogen, testosterone, all of the different hormone things. But today I really want us to zone in on bones. Let's zone in. So welcome, Sasha. Welcome, Stephen. Glad to have you here. Welcome, Nat. And let's get started. Yeah.
Yeah, sounds awesome. So, Sasha, could you tell us a little bit about what is it that happens to a woman's bones in the perimenopause, menopausal state?
So let me actually share a graphic with you guys. Let me see.
Yeah.
Oops.
I have to think.
Can I
Yeah.
share?
Yes. I'm
Okay.
getting. I'm allowing you now. Yeah. You can go
Okay.
ahead.
Let me pull it up. Okay. Can you see that? Oh, wait, no,
Not
It's
yet. Yeah.
not yet. Hold on.
almost there.
Oh, wait, no,
There you
that's,
go. Yep. There it is.
okay, I can do that better. Hold on. There we go. Okay. So from birth to about our early 20s, that's when we get um, maximum increase in our bone density, right? It's all sorts of great things happening. Bone breaks down and regenerates continuously throughout our life cycle. However, when we get to our 30s, you'll notice here that it starts to plateau a little bit. And as we go into that late 30s, you notice that it starts to decline right around here in our mid 40s, right? When the perimenopausal phase comes in, we start to lose our bone mineral density at about 0.4% a year. When we get down into that late 40s, that yes, the 50 to 54 menopausal age, you notice that precipitous decline. Estrogen and progesterone fall, and our rate of bone density loss moves up to 4.4% per year. Why does that happen? We have cells in our bodies called osteoblasts and osteoclasts, and not to get too technical, but the osteoclasts actually break down the bone, right? It helps to pull out the minerals, and then our osteoblasts kick in and help to regenerate it. That's how, when we end up with a fracture, our body is able to heal. Estrogen helps to inhibit those osteoclasts that break down our mineral, the mineral content of the bones. It also helps to encourage the osteoblasts, who are little builders who try to add back to the scaffolding. Progesterone also helps to encourage that rebuilding process. So when we reach menopause and estrogen and progesterone both start to decline, those osteoclasts pick up pace, and we end up with more resorption or breakdown than we end up with rebuilding. And you end up with something that looks like, here, get it,
It's really scary.
that, right? So this is what your healthy bone would look like, with a very
Wait,
tight, are you
it's
seeing this?
not yet, no.
No? Let's, still no?
Still no.
dear.
So no.
All right, let me try that again.
So we know that just while you're looking or figuring out that technology, we know that strength training pressures muscles because it tears them down, they build back stronger. But we never really had it like ingrained in us as children about what builds bone. So okay, so here we go. We see the healthy bone and the osteoporotic bone.
So you notice the spaces in between those gaps become much bigger because we're not getting the level of refill that we were getting in our 20s and our early 30s. So this is what it starts to look like, which is what makes it more susceptible to fracturing as we get older. Now, we once thought that, whatever you ended up with, you ended up with. There was a meta-analysis of a lot of studies that in 2020 that said that not only can we slow the degeneration, but we can actually increase our bone density through resistive training, right?
Even after that decline has started to happen.
Decline has happened. There's evidence that if you are still in that perimenopausal phase, if you are still having a period, in our luteal phase, which is that 2 weeks after ovulation, where estrogen is high, progesterone is high, that you can actually build more strength in that time. That window is your ideal window to build strength. So you want to, if you are still having a period, that's when you want to push it. That's what we want to tell our daughters, is that we want to start early with building the maximum bone density that we can. It's not too late. It's never too late, but the earlier we start, the better off we'll be. Now, genetics plays a role in that. Our lifestyle factors are going to affect how much bone density we have at a baseline, but we can affect it with resistive training.
And what type of exercises are best for that? So when you say resistance training, I think, or resistive is the word you used. I think weight training.
It's not just weight training. There are actually, when we're talking about osteoporosis and exercise is appropriate for not only heading it off, but managing it, you want to do weight-bearing, high-impact exercises. And I know it sounds counterintuitive because we think we're frail and we're fragile, so high impact doesn't make sense. But we start at a very low load. So things like hopping and just jumping up and down a step. And you may start with a very, very shallow step, and you could hold on if you're afraid of falling. But you want to give yourself something where you are working against gravity using your own body weight. And that helps to stimulate those osteoblasts that help to put the bone density back in. So simple things like hopping and jumping, if you are coordinated enough to use a skipping rope, skipping would be a great exercise for that. Step ups and box jumps if you are at that place. If you are not already there, that's not what I would encourage you to start with, obviously. But so we want to do weight-bearing, high-impact exercises. You want to do what you talked about, those weights. We want to do something that encourages us to increase our strength and stability by adding a weight or some sort of strain. So resistance bands, dumbbells, kettlebells. You want to do a weighted squat. You want to do a weighted lunge. You want to do banded walks where you're just adding some resistance to the body to challenge it through the range of motion.
Gotcha. So like a lot of those exercises that you talk about use the lower extremities, use your legs. Does that mean that I'm only strengthening the bones in my legs when I do those? And are there things I should do for my upper body?
Well, while you're doing those weighted squats and lunges, you would be holding a pair of dumbbells just by engaging that grip. Grip strength is actually one of the indicators of longevity and health, and just holding a heavy weight is going to help to increase your upper body strength and your grip strength. You can do bicep curls, you can do shoulder presses if they're appropriate, You know, there's no limit to it. You want to strengthen your upper body as well. You want to do those shoulder presses so you can put away your groceries and your suitcase in the overhead compartment. You want to do the squats so that you can bend down and tie your shoelaces. You want to do the lunges so you can reach into your cabinet. So all of these things, when we add the resistance to it, are going to help us to be able to do those for a much longer time.
Gotcha. I guess this is why I see people in the gym doing jumping jacks while holding dumbbells.
You know, if that is appropriate for you, right? So if you have been doing that and you've not had any issues, that continue to do that. If you have not been exercising, I don't suggest you hold weights while you do the jumping jacks. Just work on the form of the jumping jack. Just work on, if you can't do a box jump, then just hop up and down on a low step. And
Right.
you increase the dose of how much resistance and how complicated those movements are over time, and as you feel more confident, as you get stronger.
Mm-hmm. You know what I've seen? I've not seen here. I don't know if there's any gym, maybe you might know here, that has TRX cables, but I see women holding those TRX cables and jumping with it. So I guess that adds a little stability and helps with that explosion. Yeah. Do you know, have you come across anywhere here that trains with TRX cables?
I do not, but I am not the authority on that. So, I can't speak for whether it's there or not. I'm not aware. So
I guess this is why our kids are always encouraged to skip and run and jump, eh? Because that's when they're doing their building.
Absolutely.
Interesting. What's up, Nikki?
No, I was just going to ask Sacha. I mean, those are all amazing exercises. Are there any that we should not be doing? What should we not be doing to prevent fractures, injuries, those kind of stuff?
Just generally anything, and this is a pretty broad sort of caveat. It's anything where we are folding forward and twisting. So a forward and twist is where we're going to increase our risk of compression fractures in our spine. We're putting it under the maximum load. So anything where we're coming up into a bicycle crunch, for example, or you know, anything that sort of looks like a fold forward with a rotation. We want to focus on our posture. That forward rounded shoulders and that slumping is actually associated with a higher risk of compression fractures in the spine for women, right? So in terms of exercises, you want to avoid anything that is heavy on forward folding with a twist. It's not that you can't fold forward. It's not that you can't twist. We don't want to forward fold and twist. And again, it's going to be dependent on the level of fitness. It's going to be dependent on the degree of bone loss that you already have. It's just sort of a broad recommendation that we avoid that movement specifically. You know, anything, if you know that your coordination is not the best, then maybe we shouldn't jump rope. Because your increased risk of tripping and falling becomes an issue. I see a question coming up about Russian twists. I would avoid Russian twists as one of those exercises because of the amount of compression and adding resistance to it.
Is that only if you have an issue, or is that?
That is only if you have an issue. They're generally, you know, and again, like everything else, what applies to one does not apply to everyone. It is an individual. It is an individual consideration. You know, I get people all the time, well, running is bad for osteoporosis. Well, if you're a woman who is in her 50s and has been running and you don't have any issues, continue running. If you don't, and then don't start running necessarily, if that's not something that, or you've had a history of repeated injuries, then maybe that's not for you. But I would never tell the woman who is already running to stop running.
Okay. So beyond exercise, I mean, what about for the women who don't go into the gym or they're not able to do that? Maybe they have injuries or whatever, so they don't do it to the gym. Are there other ways that they can protect themselves, or what they should be doing or not doing? I don't know, getting in and out of a car a certain way, sitting on a chair a certain way to help prevent injuries?
So again, we talked about when we're sitting at our desk and our computer to be mindful, and this carries over not just for the bone health, very nice, Nikki, not just for
Somebody shut
osteoporosis
up.
generally, that you want to avoid being in that forward slumping. We do it a lot with our computer, then we go in our car and we fold forward, then we sit on our phones and our tablets and we fold forward again, we slump into the chair and watch our Netflix. What it does is it creates a pattern of that forward folding, which just makes it more difficult for you to do a lot of the other activities that are going to help to keep you stronger later on, right? It also changes your center of gravity. Our head comes forward, which is the heaviest part of our body. If our head is slumping forward, then it's going to bring us closer to the ground and to tripping, and that's not what our body's ability to maintain that upright posture is what we're looking for. And you want to keep the muscles in what we call your posterior chain as strong as possible. So just in day-to-day life, sit up, focus on pulling those shoulders down and back. Get up and move frequently at your desk. We can do exercises at home that don't require a gym, that don't require equipment. The best exercise is going to be the one that you're going to continuously do, the one that you enjoy, the one that you are able to afford, because what one person's budget is not the same. So maybe a trainer, and a gym membership are not on the cards for you. But do you have a pool? Could you go walk in your pool? Could you just walk up and down your driveway? Just walking is going to give you significant health benefit. In recent times, we've been talking about adding a weighted vest to increase the amount of compression. It actually will, just without any other effort, make walking more of a bone building exercise.
You advocate for those? I mean, to me, when I think about weighted vests, I mean, I suppose if it's too heavy, I mean, my tendency would be to, almost feel like it's pulling me.
Well, the idea again is to start low with the weight and increase the weight. I think the recommendation is no more than 10% of your body weight, right? But it's also going to encourage you to work on those muscles because we spend so much time forward. Yes, our muscles are going to want to pull us forward. Will it encourage us then to spend a little more time upright? The science says that it is beneficial. I'm a science girl, and the evidence is there for the benefit of using a weighted vest. Again, is it necessary? No. If you have it available, yes.
Okay.
But things as simple as carrying your groceries and maybe carrying one extra bag will add some extra resistance. You can certainly do exercise at home. There are lots of online programs. I would encourage you, if you already have osteoporosis or osteopenia, to seek the advice of or have someone go over a program with you to make sure that you are doing them safely, and then continue the program if that's what's available to you and that's what you can manage with your schedule and your budget and the demands of life.
Thanks for that. What about flexibility type training programs? So things that are, whether we're looking at like yoga, for example, does that help with bone density at all?
Anytime you are paying attention to joint, tendon, ligament, connective tissue, you're going to have some benefit on the support for the bone. So as we get older, we also have sarcopenia that sets in, which is the loss of our muscle mass. It's all these great things that go along with it. Yoga, Pilates, pool aerobics, all of these activities increase your joint mobility. By the movement, you're going to get some benefit in stabilizing the joint, and that's going to give greater support to the bone, increasing the compression of the muscle on the bone, and then helping with the bone density as well. So if you enjoy, again, the only thing is with yoga, for example, those deep flexion poses, pigeon pose, warrior, where there's a lot of twisting, then maybe I would not do those poses. But if you work with, we have great yoga instructors, we have phenomenal Pilates instructors, full aerobics, that if you seek them out and seek and have that conversation, that they can give you a safe program to do.
So if you're not diagnosed as osteoporotic, but you are in perimenopause, is it okay, and you've been active, is it okay just to continue being active and just adjust if something doesn't feel right? Like, how do you? Okay.
Absolutely. And go with, if it doesn't feel safe, stop. You know, trust what your body is telling you. And if it doesn't feel right, if you're working with a trainer and they give you something and you know this doesn't feel right, say stop. At some point, this goes for whether you are a man, woman, menopause, perimenopause, not. If it doesn't feel right, if it doesn't feel safe, don't do it. That deadlift may be okay today, but the deadlift after I've been sitting in a meeting all day and then I drove to Mobay and back, that's not the day to do a heavy deadlift.
Right. Yeah, I guess pay attention and know your body and advocate for yourself, because a lot of these trainers will just push you because that's what they think they're supposed to do, as opposed to understanding the safety boundaries. So would it be okay to ask Dr. Lofters some questions? No, he's around. Yes. There we go. Thank you. And thanks so much for taking time, both Sacha and Stephen. Thanks so much for taking time out of your busy schedule. I've heard about bone density tests. I don't know anything about them. What exactly is a bone density test, Dr. Lofters?
The common one that we have is something called a DEXA scan, which is basically stands for dual energy X-ray assessment. So it basically is a very low dose X-ray scan of the entire body, which is done with a standard X-ray, standard dose of X-rays that allows the computer system attached to determine the density of essentially all the tissues. But what we're interested in a DEXA scan are the bones. You can use DEXA scans to do things like find your body fat percentages and stuff like that. But today we'll talk about the bones. So the DEXA scan is usually done for bone density of the lumbar spine and the pelvis and the hips, right? And it allows us to compare the density of the patient's bones to a recorded known value that's for a healthy young adult. Right? So when you do a DEXA scan, your bones are being compared to, even if you're 90 years old, you're going to be compared to a healthy young adult's bones to see if your bone density, how your bone density compares to them. Okay, the machine will give us, basically there's a lot of technical stuff that goes on in the background in the computer, but at the end of the day, the computer will give us readings for each level of the spine and the pelvis and the hips. Right? What's called a T-score, which is your score compared to the normal healthy adult. Score of 0 is what a young person should get. Right? 0 to -1, still within normal range. That's normal. -1 to -1.5 is osteopenia. And no, sorry, -1 to, I'm losing the numbers now. 1 to 1.5 is osteopenia. Below 2.5 is -2.5 is osteoporosis. Okay. Right? So all these numbers are being compared to young people. Once you get into osteoporotic territory, that's when you're at high risk for having fractures just from a simple fall. You slip and fall and you can break a hip, which in a young person is something that would only happen in something like a car crash or fall from a height. So that's how we can use technology, the DEXA scan, to give us indications as to whether a person is having bone loss, bone mineral loss, even if they look healthy.
Why are you only looking at the lumbar spine and the pelvis? Why don't you check like the other bones as well?
Well, the osteoporosis is going to tend to be a systemic issue. It's not going to be something it's not really a spot thing. It's not a focal thing. So it's a standard thing. Those are the areas that they're big bones that are easy to image with the DEXA scan, because remember, it's a very low dose procedure. So you're not going to be trying to look at your finger and you won't see those things. You're going to see the big, thick bones, and that'll give you the best readings to help to diagnose you.
I get you. How do you know if it's a good idea for you to start getting these scans, or if you should even do one any at all?
General, one second. So in general, they're done it's recommended after the age of 65. You should just do it just like how you do your mammogram. You can screen for your osteoporosis as well at that age. The you don't have to be limited to that though. So some
Okay.
people have risk factors that predispose them to get an osteopenia or osteoporosis at an earlier age. Those people can start earlier as well. So if you have, for example, chronic disease, rheumatoid arthritis, right? If you're on long-term high-dose steroid therapy, right? Those are the kind of things that would predispose you to getting osteoporosis even at an earlier age. So if you have any other reason, it's not a problem to do the DEXA scan beforehand. The dose is very low, so it's not dangerous. And it's very informative in terms of giving you the information that you need. Also, if you have a very strong family history of osteoporosis, it's a good idea to start earlier as well.
But would it be harmful for just a woman who's entering menopause to say, you know what, let me get a baseline and see where I'm at?
It's not harmful. It's not harmful. You can always do that to get your baseline and follow up with that in the future if you have symptoms, things like height loss, bone pain, or if you're on any other, like I said, medications or have any other reason. We can always repeat it in the future. But at menopause, a baseline is not a bad idea. At that stage, you have all the hormonal support. If you're healthy, your bone density should be normal. But it can't hurt. The DEXA scan, like I said, is very low dose. The X-rays dose is not really a concern. And so doing that one scan to get that baseline reading isn't a bad idea.
Can you differentiate between osteopenia and osteoporosis? You mentioned limits of the scan results,
Yes.
but what does it mean?
It's basically a spectrum. You have a spectrum going from normal through osteopenia, which is decreased bone mineral density, into osteoporosis, where the bone density is dangerously low and you fracture. The fracture risk is significantly elevated. So it's a spectrum of bone mineral density loss.
Gotcha.
And we have arbitrary numerical limits for each category.
Okay, kind of like pre-diabetes, diabetes.
And you have the numbers, the sugar level, the sugar numbers that kind of define those. Yeah.
So many questions. From a supplementation perspective, right? So Sacha talked about the different types of exercise. Anne-Marie is asking in the chat, from a supplement perspective, what supplements or nutrients are important to maintaining bone density?
So the nutrients that are important are going to be calcium and vitamin D. So calcium is an important component of the bones and give it its strength and hardness. And vitamin D helps you to absorb and metabolize that calcium. So those two supplements are two things that you can ingest and you can make sure that you're not deficient in. That will kind of optimize your body's ability to do its normal processes to keep the bones strong. And being deficient in any of those things will put you at a disadvantage, make it easier for you to slide down that scale into osteopenia, your process.
Right. The other question that I had just magically flew. Oh, HRT.
But I have a question. No, I have a question. So you go and you have your test done and you find out, okay, you are going down a slippery slope. You're not going in the right direction then, if you will. You can do your baseline, perimenopause or menopausal woman goes and they get this reading and it's not where she thought it was going to be. What do you recommend she does at that point? Maybe it's a question for both of you. I don't know.
Yeah, so that's it. So I will talk to this, but like I said, I'm a radiologist, so my job is the imaging. The treatment part's usually done by others. But in general, just like was discussed before with Sacha, was that you're going to start with if there are modifiable lifestyle changes you can deal with, things like weightlift, like resistance training. Okay, when we do our X-rays, you can see the difference in the bones of a young adult that's a bodybuilder, for example, and just a normal person that doesn't do any weightlifting. The density changes in the bones for the bodybuilder. Their bones are dense like iron. And then you can see that on the x-rays. You start off with that, even though you lose bone density as you age, you'll still have stronger bones than the average. So that's something that I would recommend is resistance training, weightlifting. Is something that as a modifiable lifestyle change. Things like stopping alcohol, smoking, all those lifestyle things can help to accelerate bone loss. Just not having a sedentary lifestyle. If you're deficient in the vitamins, make sure to supplement if you need to, or just eat a healthy diet. And those are some of the things that you can do just from a lifestyle point of view. Apart from that, the physicians would also can prescribe certain medications that would help to increase the bone density. The bisphosphonates are one that I can think of, and there's several others. Like I said, I'm not an example. I'm not an endocrinologist. I don't deal with that in terms of what I do for a living, but there are medical treatments that can help in the long term. So remember, there's no quick fix for this. So even if you decide to put you on these medications, it's a long-term thing where you're going to be coming back year after year to see if the bone density slowly increases over time. And there's not a thing where you take the tablets and 3 months later it's your the T-score of 0. You're going to take a long time, along with the lifestyle changes, you put everything together, and that's what give you the best benefits.
What about genetics? If your grandmother or your mother suffered from osteoporosis or any of those, is that something that I mean my
Very
grandmother
important.
did and most grandmothers did. Is that something that I need to be from now checking my bone density because it is a genetic thing?
Yep. So genetics play a big role. So if you have a strong family history of osteoporosis, start before 65, checking your bone density. But other factors such as if you are a very slim and slender build, increased risk of osteoporosis. Um, Females also tend to have a higher rate of osteoporosis. Men can get it as well, so the men shouldn't just ignore the whole issue. But women just tend to have a higher rate of osteoporosis. So those are the kind of things that factor into it. But genetics do play a role, and just having a strong family history is enough to make to say that you should pay attention to that more. Get your DEXA scan done earlier. Pay attention to any symptoms you may have. Like I said, with some of them things like height loss, bone pain, easy fractures of any bone that you think, boy, that happens kind of easily. One check.
Okay. Well,
What about if you're on hormone replacement therapy, which is something that we've discussed pros and cons at length? Is that protective from
So yes, so
going
hormone
down the
replacement
spectrum?
will be protective in the long term to slow the bone loss and slow the slide into osteoporosis. But it has its pros and cons. So you have to also discuss with the patient the risks associated with it. It doesn't necessarily cause anything, but if something bad, for example, in the breast or ovary pops up while you're on HRT kind of is like adding a bit of fuel to the fire kind of thing. So you have to make sure to do all your screening and
Mm-hmm.
self-examinations. So it's not a magic bullet. You have to take the pros and the cons and weigh the risks, but it does slow the progression of the osteoporosis, and it's something that you can add to the arsenal of medications, so the arsenal of treatments, apart from the
Right.
lifestyle and the bisphosphonates. You can add that as well.
Okay. So we know that you are an avid gym goer yourself personally, right? And I know that you were on when Sacha was describing the different types of exercises that help with bone density. Is there anything that you would add to the repertoire that she shared? Things that you think are particularly useful?
I think from my point of view, the things like you were saying, the impact sports, or like even just good old fashioned dancing. Like, so we're talking about people who are going to be older. So you have to I kind of have to at times take myself out of my 20-year-old or my whatever age I am now, self, and say, okay,
Mm-hmm.
not going to be doing kung fu, playing rugby, or lifting up a ton of weights, but even things like just going walking, right?
Mm-hmm.
Just the impact and having to carry your body around to strengthen your bones,
Mm-hmm.
aerobics, dancing. any kind of sport which causes your bones to carry weight will cause them to get stronger. I still think even no matter how old you are, lifting weights is an important part of life. Having that muscle and the bone that comes along with it is important. And so resistance training as best as you can is always on top of my list in terms of exercises as you get older. And my mom is getting up there now, and I keep on telling her, do your squats. She walks for an hour and she has her little weights, and I'm on her all the time, and it makes a difference. It makes a difference to the quality of life, and it's one of the things that I recommend personally to everybody.
I love it. Is this why they say I see a lot about the farmer carry on Instagram and your ability to carry for women, I believe half your body weight for I can't remember the distance, but is that one of the reasons that the farmer carry is such an important exercise to include?
Farmer, so the same thing. It's just being able to load your body, having the muscle strength and the bones that come along with that strength to load your body and be functional. And so the farmer carry, even just grip strength, being able to just hold on to a bar is an indicator of how well your bones and body are doing. And so I think it's not so useful to get into the specific exercises because everybody is different and some people don't like this, some people like that.
Mm-hmm.
It's just a matter of doing something that challenges you, right? And sticking to it, being disciplined to it and doing it regularly.
Gotcha. Is there, like if you have are there symptoms that we can look out for that could be like warning bells that
Yeah, so
of
main
bone
things that
density?
some of the main things that you would notice are one of the things that's easier to notice is loss of height. So you notice that you have an older relative and they seem to be getting shorter. That is a
Mm-hmm.
that is a red flag that bone loss may be happening, and literally the bones are getting smaller and they're getting
Mm-hmm.
shorter. So that's one of the main ones. A lot of the changes are silent, and so
Mm-hmm.
most times you have no indication at all until you trip, and all of a sudden your hip is hurting you more than it should. Right, so a
Mm-hmm.
lot of times it can be very difficult to tell, but things like height loss, sometimes some people get bone pain, right? Easy fractures, so you fall and you just break your hand on something that
Mm-hmm.
was trivial to you. And so any other fracture that seemed a bit too easy are some of the main things. But a lot of the changes that come along with osteoporosis are silent. Skeleton is in the middle of your body, and unless you really stress it, it's not going to
Mm-hmm.
sitting there not doing anything. So you don't have the symptoms that you may have from another process. So one of the main things that you can look for in an older relative or yourself is things like height loss.
Mm-hmm.
What about
Well,
you talked about frequency of doing this of these bone density. So for a woman who perimenopause or menopause, she does it, everything seems to be okay. Do you recommend that she does it every year after that?
So on treatment, it's usually once a year. I'm not sure if it needs to be done as often as a year if you're normal, right? Let your doctor guide you as to the frequency. But once you're on treatment, it's once a year just to see if there's any change in general, because the changes are slow. There's no rapid up or down in general with these things. So once a year is the most often that I've seen it really be done. And it should be once every couple of years if you're normal.
Anybody have any questions? Please pop them in the chat. These lovely guests would be happy to answer. So if you have any questions, jump into the chat, please.
it's amazing how common the thread is of eat well and exercise. Eat well and exercise seems to take care of 80% of, and I'm just throwing a big number out there, but of our challenges in life, whether it's, I don't want to get diabetes, I don't want to get high cholesterol, I don't want to lose my bone density. Everything points to eat well and exercise.
Absolutely. Yep. Okay,
Phenomenal.
so I agree with that 100%. It's a whole pronged approach. It's a whole approach?
Well, I think not to have anyone get intimidated, right? We want to, yes, we have to eat healthy and exercise. We want to do an all or something approach rather than all or nothing. So if it means I can only walk for 5 minutes today, walk for 5 minutes, right? It doesn't have to be, I have to go to the gym, I have to put in an hour, I have to do, these specific exercises. Any movement is good movement. Anything is going to make a difference. Sunshine, fresh air, and movement are three key components to, I think, health. I sit and I get a lot of patients who have, neck pain and numbness and all these things. And if I could just get them to get up from their desk every 20 minutes, it would solve a lot of the problems. And that would then carry over to the blood sugar, to the hypertension. So when we say eat right and exercise, we don't have to eat grass and work out 4 hours a day, but do something. Is what I'd like to.
Yeah, I love that. I was really inspired by a post I saw on Instagram one day, and it was this guy talking about his ideal workout. And he's like, but I have like my process is that I have my ideal workout where I have 2 hours and nothing to do. Or I have my bare minimum, which is for him, it was 100 push-ups. So what is your bare minimum? What is your bare minimum? What can you do? And you're right. Like walk for 5 minutes or do 10 squats in the bathroom or drop on the ground and try do 5 push-ups or, like what can you just add in to your life so it doesn't feel like crazy. And of course, we're not saying that this type of approach to exercise is going to build a fitness model type physique. We're talking about like maintaining the integrity and functionality of your body, right? Yeah.
So where can we do these scans, Dr. Lofters? Where can we do these bone density scans?
So I think there are a few places in Kingston, but the one I know of is where I work, Ripon Road. One Ripon Road, which is the same complex as most people may know Ship Me. So they have a machine here. It's comfortable, it's quick and easy to do. The appointment times are very short. So Ripon Road, and I think there's one other, but I'm not sure, to tell the truth. I'm not sure where it is. I haven't seen any others where at the places that I've worked. I'm apart from Ripon Road.
Are you aware of the general level of pricing? Is it a very expensive test, or is
It's not
it
particularly expensive. $35,000 here. And the other places, the prices will be generally the same ballpark, 20, 30.
Okay. And we have to come with a referral letter from our doctor? Like we need a...
I think that one may be a screening test where you'll be able to go without. It depends. It will probably be dependent on the practice. But probably the safest thing to do would be to get the referral from the doctor and come. That allows you to use your health insurance, etc. If you have a referral. If you come on your own without the referral, it wouldn't be covered by the insurance.
Gotcha.
Okay. Well, that answers Tanya's question. Yeah, Tanya was asking if it was covered by insurance. So,
and Tanya also says the women's place, right?
Women's place. On Stanton, I think it's Stanton Terrace, right? I think so.
I don't know where the women's place is.
Yes, it's on Stanton Terrace, off Mountain View there, top of Mountain View. Yeah.
Which is where Sacha's office is.
It's
not at the women's place.
Not at the women's place, but I'm close by.
Okay. That's good to know. I'm going to write these. I'll put all of these stuff in the email for the people who are rewatching the replay or watching the replay. I'll put all of this information in there. So let's make a quick note. Okay, go ahead now.
And I'll send you, Anne-Marie was asking if there's a particular supplement that has everything that's necessary. So I'll send you something to include there as well. Because sometimes I stand at my vitamin cabinet for a long time, picking and choosing what I'm going to take today. So oftentimes a one-shot pill is very useful. So many supplements. Is there any myths, either Dr. Lofters or Sacha, are there any myths about bone density that you've come across that we need to dispel? Anything that you're like, wow, where did people start thinking that one?
From an X-ray point of view, not something that the lay person may be able to use. But from a radiologist point of view, one thing that we found in our practice here is that you can't really use the appearance of the bones on the plain films like you do on the X-ray of the lumbar spine, an X-ray of the thigh. A lot of times, the patients who you think are going to be normal because of how they look on X-ray turn out to be osteopenic and osteoporotic, strangely enough. And the patients whose bones look a little bit demineralized on X-ray turn out to be normal, right? So when you're doing a normal X-ray, like a chest X-ray or a lumbar spine X-ray, you have to adjust all the parameters for the size of the patient, etc. And that can really affect how the bones look. And so it makes a difference in terms of how they look. So you can't use the X-ray film appearances to make a blanket statement about their bone density. The DEXA scan is much more accurate and much more useful in terms of getting that bone density and knowing exactly where you lie in that spectrum. I'm going to have to beg your indulgence. I have to run. Work beckons. Thank you, Pat.
Thank you so much, Dr. Lofters.
Thank
Quickly,
you.
the name of the place that you work? What's the name of the place you work?
X-ray and diagnostic ultrasound consultants.
Okay, great. I'll pop that in the email. Thank you so much for your time. Really, really appreciate it.
Yep, thank you.
Thank you. Thank you. Thank you. Sacha, what about you? Do you see myths or misconceptions that come up in your practice?
I think the one misconception I'd like us to dispel is that once you have a diagnosis of osteopenia or osteoporosis, that suddenly we are made of eggshells and we are fragile and we can't control or change anything going forward. Because I think the biggest disservice to someone, to a woman who is with that diagnosis, is instilling this sort of medical hysteria, as one of my friends likes to call it, this fear. Because you start off with this fear, maybe I've fallen already, and maybe I've had a fracture, and now I am so afraid of moving and falling again that I limit my activity. Then I limit my activity, and I get weaker, and I lose more of my balance and stability, which means that I'm probably going to fall again. And I think if we say to women, listen, we're going to control the controllables. Yes, we're going to deal with the treatment. It's not my scope to tell you what treatment is ideal for you. But, certainly adding the resistive exercises, having the conversation with your doctor and making educated decisions on our route. It may be HRT, what type of HRT, it may be the medications, whatever that is for you. Arm yourself with knowledge, do the research, and recognize that we can make changes, just as we talked about at the beginning, that we can improve. We can not only sustain and maintain our bone density, but we can improve our bone density with resistive exercises. And it doesn't have to be a hardcore gym workout. So the diagnosis is not a death sentence. It's not we're now old and we're frail and we just go in a box and we do some chair aerobics and some wall Pilates and that's all we can ever do again. That's what I would like women to take away from it, is that a diagnosis is not not an indication that we're ready for the shelf.
We can be strong little old ladies.
We can be strong old ladies.
Not getting old, Natalie. What's the matter with you? We're not getting old. We're getting strong, but we're not getting old.
Okay. Older. There's another question that's coming to mind, and I don't know if it falls within your purview, Sacha, but there's been a resurgence of fasting, people wanting to fast. There's intermittent fasting, there's time-restricted eating. Some people do like eat, stop, eat, where they do 24-hour fast. You even hear about people being on a water fast for like 72 hours. Like, what do you think about fasting vis-a-vis bone density?
I do not have any sort of scientific answer for that.
Okay.
The science has been saying to us we need protein. We've come up with this magic 35 grams of protein first thing in the morning. We want to get the protein in. Protein is one of those key components of bone density and muscle mass. Remember, we want to keep the muscle mass, we want to keep how much of that you're going to lose in the fasting. Is it appropriate for some persons? Sure. Is it appropriate for everyone? Not according to the research I've read. And this goes back to an individualized approach. Have that conversation with your physician, have that conversation with the people who are equipped to answer that specific to you. If you are diabetic, no, fasting is not an option. And how you fast, how long you fast. If you're going to work out early in the morning, so for my early morning workout warriors, is an intermittent fast appropriate before trying to get the maximum benefit out of am I going to be able to lift as heavy because I'm fasted from 6 o'clock in the evening before and I'm working out at 7 the following morning? Am I going to get the most out of the work I'm putting in relative to the benefits of the fasting that I'm going to do? So I'm not speaking to you with any sort of authority on it, but
those are the things to consider.
Those are things to consider.
I used to work out fasted all my life, and I've recently started adding 20 grams of protein before I work out. And the difference in my ability to work out is
remember,
phenomenal.
we talk about cortisol. Cortisol is one of those buzzwords around menopause too, and that cortisol increases. Most of us operate at a high level of cortisol in our lives because our stress response, life just keeps that cortisol burning high. If you are adding, I've had a rough day. I didn't sleep particularly well, which is another one of those things that happens to us in perimenopause and menopause. So I'm tired. My kids are driving me crazy. I'm going to murder my husband. And now I am hungry and I'm going to go into a workout and I want to lift weights and I want to run. I want to do aerobics. My body doesn't know the difference between I am intentionally fasting necessarily. And you know what? I'm in some sort of crisis. There's no food available. And that cortisol then increases inflammation. Then the joint pain comes in. Then we don't want to exercise because everything is hurting. Again, it's not everyone's experience, but one of the things to consider is that fasted state can also fire up the cortisol. So
let's switch a little bit back to or over to physiotherapy. So for a woman who maybe has, I don't know, back issues or problems in the past, or she has been diagnosed with osteoporosis, but still wants to do the weight training because it's important for her. Does physiotherapy help with that? Do you recommend women to do that as well as?
The benefit of therapy is we can help you navigate what is normal. I get my women, this is normal. I hear this clicking and I hear this popping and this feels a little, is that creaking normal? This feels a little tight. We can help you to navigate what is safe and start by maximizing what we consider functional mobility, what you're able to do for your daily living activities. Can you do those things, and then help you figure out how to add the other things on top of it. So it really is to help you get over the fear. We talked about that fear cycle. It's to empower you to do more, help you figure out what is normal and what is not. There's a difference between I'm training and I'm challenging my muscle and I am sore, achy pain, as opposed to I have a sharp stabbing pain. Sharp stabbing is not okay. Sore, achy, we're going to work with that. Looking at sort of your mechanics, a lot of my women, a big challenge with balance and stability and therefore fall risk is our foot mechanics. We wear a lot of pointy shoes and heels, and a lot of my women, their toes are all scrunched up like this. That compression of my toes actually makes me less stable. It reduces my ability to lift my foot, so my increased chance of stubbing my toe and then having a fall. So therapy can help you to navigate some of those mechanical things, as well as identifying things in your environment that are risk factors. Do we need a grab bar in our shower? Do we need a non-skid mat? Do we need to take up some of the things, that fancy rug that we have that you keep tripping on? Or maybe we just need to pick that up, right? Are we wearing proper shoes? Those are some of the things that therapy can help you navigate and then send you on the road with a consistent.
I love
So you
that.
can
I think that's
safely.
important. I think that's so important for women to really identify. Like you do your base scan, you know where your bones and your levels are at, and then you have and go to a physiotherapist like yourself and really have that conversation. Am I doing, go through the whole thing? Am I doing this the right way? Should I be doing this? What does this look like? And I think that that's amazing. I think doing that, it gives us knowledge. It gives us power to protect ourselves.
And that's the point of therapy. I say to people all the time, the point of therapy is not to get good at therapy. The point of therapy is to be able to take the information and then make changes where they're necessary. I have never turned water to wine. I can only give you the information and then, you make those changes. And I think that's really, you look at the individual on an individual basis. If I have 10 patients with osteoporosis, I have 10 different treatment plans because my treatment plan for Natalie is going to be very different from my treatment plan from my 30-year-old factory worker. Is going to be very different from my 60-year-old, homemaker. And you have to take all of the factors and help that person make empowered, informed decisions. And that's really the goal of.
But getting that knowledge from you, I think, is important. When having that consultation and getting the knowledge that you can say, just as here's a treatment plan, or here, let's try this. Maybe, I think that that's where it starts because we have to build our knowledge. We have to know what our numbers are. We have to know what we're doing. Are we doing this thing right? And having the consultations with you or going and having your bone density, I think is so important for us as women at our stage of our life.
Us as professionals, our job is to keep as informed as we can. There's always things, the research changes, the knowledge changes, the base of information changes. Natalie will tell you, I started spinning and I loved spinning. So I did a spinning instructor training. I'm entering this stage of perimenopause, menopause. So I did a menopause coaching certification so that I could understand it better. Right. So the information that I'm giving you is not from a point of just arbitrary, conversations on social media. It is from a body of science and of investment in learning so that we can give the women we interact with the best possible information to work with. Now, what I do is not necessarily the best for everyone, but I'd like you to have the option and way, just like with our other practitioners, our GPs and our gynecologists and our endocrinologists and everybody else. Go into it with as much information on your own. Ask questions.
I'm so glad to hear you say all of that. Yeah, and Sacha, that's one of the reasons why we love you. I had a client I saw just last week who still, and I say still because I feel like everybody should know what's going on now. But her doctor, who is a very well-respected gynecologist, ran her out of his office, telling her that the pains she was having were all in her head. And when she came and sat down with me in tears, classic perimenopause, everything, classic menopause. So we still have practitioners trying to convince women it's all in their head, and it's not, So I love that you got certified in something. I had no idea. I love that. And I think you'll be a great resource for many of our women.
We do have limited things that are available to us. And I think sometimes our doctors, it's easier to just say, it's not that. We're going to do some antidepressants and some anti-anxiety, and let's just do it because that's what's available. HRT, some of the other options are more expensive. The osteoporosis drugs are significantly more expensive. So it's easier to just tell someone, well, just don't jump and, use a cane. than to say, hey, there's a drug, but I'm not sure you can afford it. And this is why we have to make those decisions based on the information we have and within what's available to you individually. So the more information we can get out, I think is the service that we can give to women going through this. The great thing is that there's a lot of information now. There's still far less research in women's health. I think I read a statistic that 9% of the money spent on health research is in women's health. But for every piece of information we can get, then we can share that and
women
strong,
supporting
healthy women
women,
in
Sasha, it's women supporting women. It is getting this information out there for these ladies to make informed decisions on and empowering their lives and making themselves stronger. So I think this has been an amazing conversation. Love this.
Yep. Thank you so much. Thank you so much. Any closing questions real quick for Sasha?
Sasha, will you send me your contact information on in the WhatsApp group so I can pop that in the email for anybody who would like to reach out to you to do a consultation to find out where they're at and what they should or should not be doing? I think that would be awesome.
Absolutely. Thank you guys for having me, and it's been a great afternoon.
Yay! Thank you, Sacha. So appreciate you being here. Thanks, Nats. And we look forward to this continued conversation.
Yes, ma'am.
Yeah.
Alrighty. Bye.
Have a great afternoon.
Day.
Yeah, man.
Bye.
Bye.